Hi friends, welcome back. In today's video. In this tutorial, I'm going to show you how to dilute, how to reconstitute IV drug medication correctly for you to administer to the patient safely. So in today's video, I'm going to show you how to dilute IV medication correctly for you to administer to the patient effectively. So before you start the procedure, make sure first you clean your working bench. So ensure first you clean your working bench. So you have to clean your working bench first before you start performing the procedure. So you have to clean the surface first to ensure sterility of the drug. So you have to clean the working bench first. Then you have to gather all the supplies that you require for you to perform the procedure. For instances, you may need a medication containing a vial or a medication containing an ampoule. You will need a syringe. You will need a 21 gauge needle or 18 gauge needle. You will need an alcohol swabs for you to clean the surface or the opening of the vial before you start injecting the needle into the vial. Okay, generally we always have a medication containing either a vial or an ampoule. So let me show you now. So this is a vial. This is a vial containing white powder of a drug, and this is an ampoule. So the medication is already in solution form. You don't need to dilute or you don't need to reconstitute. You only need to withdraw the drug from the ampoule. So this is an ampoule and this is a vial. So I want to show you how you can dilute, how you can reconstitute the drug correctly for you to administer safely to the patient. Okay, let us start with the vial first. So before you start diluting the drug, make sure you read instruction of the drug. So you have to confirm name of the drug. You have to confirm a method of administration, that is direction for use for you to administer either IV or IM. You have to confirm that. You must also look the expiry date of the drug. So you have to check expiry date of the drug. You have to check name of the drug. You have to check direction for use, method you are going to reconstitute, amount of diluent you are supposed to withdraw so that you can reconstitute with the vial. So you have to check that first. Then you have to get a syringe. So you get a syringe, you remove the syringe from the manufacturer's packaging. Okay, you will get a 21 gauge needle. So you open the needle from the manufacturer's packaging, then you attach the needle into the syringe. Always avoid touching the needle. So avoid touching the needle with your fingers. Always avoid. So this is a vial, and we also have a sterile water for injection that is 10 ml. So we need now to reconstitute, to dilute the drug correctly to administer safely to the patient. So first what you do, you open the plastic vial containing the sterile water for injection. So you twist the cap of the plastic vial for you to withdraw the sterile water for injection. So you remove the needle from the cap, then you insert into the plastic vial containing the sterile water for injection. You hold it upside down horizontally, then you pull back the plunger for you to withdraw all the sterile water for injection for you to reconstitute with the white powder of the drug. So this is how you are going to withdraw the water for injection, sterile water for injection. So you have to push the plunger, you have to tap the syringe for you to remove air bubble. So you have to remove air bubble first. Make sure you put the needle into the cap to avoid contamination or to avoid injury. And this is our vial. Now we want to reconstitute with the sterile water for injection into the vial so that the drug will be in solution form. Then you need an alcohol swabs for you to clean the opening of the vial. First, what you do, you get the vial, you flip the opening of the vial, you open it, then you clean the opening of the vial with an alcohol swabs. So you have to clean the opening of the vial with an alcohol swabs to ensure that the vial is completely safe for you to inject into the needle. So you have to inject the needle into the vial in the middle of the opening of the vial like that. So you pull the plunger for you to transfer the sterile water for injection into the vial. Then you remove the needle. You start shaking gently the vial for the drug to dissolve completely. You have to shake gently the vial for the drug to dissolve completely. So you have to shake the vial for the drug to dissolve completely, containing no visible particles or any foreign particles. So make sure before you start withdrawing the drug, ensure that there is no any visible particles inside the vial or foreign particles before you withdraw the drug. So this is how you are going to shake the vial for it to dissolve gently. Then now we want now to withdraw. So before you insert the needle into the vial, make sure that you remove any air bubble. And again, what you are supposed to do, you have to put equal amount of air for you to withdraw the blood. So you pull back the plunger with 10 mils for you to put equal amount of air into the vial for you to withdraw the drug first. So you inject the air bubble into the vial for you to withdraw the drug. Then you hold the vial upside down horizontally for you to withdraw the medication safely. So this is how you are going to withdraw. Ensure that the tip of the needle is within the liquid of the drug, not outside, for you to avoid air bubbles rushing into the syringe. So this is how you are going to withdraw the drug. After you have withdrawn, then you have to pull the plunger. You have to tap the syringe to remove any air bubble before you start administering the drug to the patient. So after you have removed all the air bubble, then you can administer the drug to the patient safely. So before you start administering the drug to the patient, make sure you follow the 7 rights of drug administration. That is right patient, right drug, right dose, right time, right road, right reason, right documentation. So always ensure that you follow the 7 rights of drug administration before you start administering the drug to the patient. Ensure that you are giving the drug to the right drug, to the right patient, to the right time, to the right dose, to the right route, to the right reason, and the right documentation. So this is how you are going to prepare. This is how you are going to reconstitute IV drug medication for you to administer to the patient. Now we shall see how to withdraw drug from an ampoule. And if you are preparing a drug containing an ampoule, this is how you are going to withdraw the drug. So the drug is already in solution form, that is liquid form. You don't need to dilute, you don't need to reconstitute. What you need is only to withdraw the drug from the ampoule. So I will show you how to break the ampoule and how to withdraw the medication from the ampoule. So before you start withdrawing the ampoule, make sure that all the drug is in the bottom of the ampoule, not at the top of the ampoule. So this is how you are going to break. So you can use a gloves or you can use cotton wool. So make sure this is how you are going to break. You hold your thumb with your index finger pointing into the dot of the ampoule. Then you pull upside down. This is how you are going to break. Okay, you can use anything for you to hold, for you to avoid injury. This is how you are going to break the vial. This is how you are going to break the vial. Then when you break the vial, you get the syringe. You get the syringe and you withdraw the drug from the ampoule. You insert the needle into the ampoule horizontally upside down. You pull back the plunger for you to withdraw all the medication. Ensure that the tip of the needle is within the liquid to avoid air bubble rushing into the syringe. When you finish withdrawing the drug, make sure you tap the syringe. You pull the plunger for you to remove any air bubble that may come along into the withdrawing. So you have to tap the syringe to withdraw any air bubbles. Then you put the needle back into the cup to avoid contamination. Always avoid touching the needle, and the inside of the blanket to avoid contamination. Always put back the cap into the needle to avoid injury or contamination. So when you finish withdrawing the drug from the ampoule, then what you are supposed to do before you start administering the drug to the patient, make sure that you follow the 7 rights of drug administration. That is right patient, right drug, right dose, right time, right route, right reason, right documentation. Always ensure that you follow the 7 rights of drug administration before you start administering the drug to the patient. So this is how you are going to dilute how to consume IV drug medication containing from a vial or an ampoule. So please, if the video is helpful for you, kindly please don't forget to smash the subscribe button, like and share, and give your comment to this video. Thanks for your watching and have a nice day.